Unfortunately, I am too familiar with ALS as my grandmother passed away in June of 2014. ALS, or more commonly referred to as Lou Gehrig's disease, is a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord. According to ALS website, amyotrophic lateral sclerosis, broken down, translate to A means no, myo refers to muscle, and trophic means to no nourishment. No muscle nourishment. When a muscle has no nourishment, it atrophies or wastes away. Lateral identifies to the area of the person's spinal cord where portions of the nerve cells that signal and control the muscle are located. As this area degenerates, it leads to scarring or hardening sclerosis in the region. To get started, let's get into some of the statistics. ALS states that a little over 5,000 people in the U.S. are diagnosed with ALS each year. It is estimated that as many as 30,000 Americans have this disease at any given time. Most people who develop ALS are between the age of 40 to 70. 60% are men, and 93% being Caucasian. An average age of 55 at the time of diagnosis, and men are 20% more likely to be diagnosed than women. Now let's hear about some of the symptoms. The symptoms and diagnosis of ALS varied and are hard to diagnose. When it comes to symptoms, one person might just have trouble grasping a utensil, whereas some might experience a change in vocal pitch when speaking. With ALS gradually progressing, each person is said to experience symptoms different times, and some will see the slow progression while others progress slower. Progressive muscle weakness and paralysis are only certain symptoms that are universally experienced by all. And oftentimes with the disease that mimics ALS have to be ruled out first. A comprehensive diagnosis workup includes most, if not all, of the following procedures. Electrodiagnostic tests including electromyography, EMG, and nerve conductive velocity, NCV. Blood and urine studies including high-resolution serum, protein, electrophoresis, thyroid and parathyroid hormone levels, and 24-hour urine collection for heavy metals, spinal tap, x-rays including magnetic resonance imaging, MRI, myelogram of the cervical spine, muscle and or nerve biopsy, a thorough neurological examination. Next, let's look at some of the treatments. As far as treatments, there is only one so far that is shown to alter the course of ALS, which is riluzole. Riluzole was approved by the FDA in late 1995 and is an anti-glutamate drug that has significantly prolonged the life of a person with ALS by at least a few months. For forms of treatment, or at least a better quality of life, include participating in support groups and attending an ALS Association certified treatment center. These centers help manage the symptoms of the disease and assist people living with ALS to maintain as much independence as possible. There isn't a way to prevent ALS, and there are still studies investigating possible risk factors and potential causes of the disease. Right now, those with ALS are expected to live between 3 to 5 years after initial diagnosis. With all that said, you now have a clear understanding of what ALS is, the symptoms, and the treatment.